Hey, it's Jessica Damaso with WTF Health. What's the future of health? I am talking to the who's who of health tech and healthcare innovation. And today we are diving into the subject of teen mental health with the co-founders of BeMe Health, which is a digital behavioral health solution that focuses specifically on teens. They're doing a lot of stuff differently over here. They've just raised a $7 million seed round, have announced that in conjunction with some partnerships with some big payers. So we're going to dive into the business model behind all of this. But first, let's meet the co-founders, the CEO, Nicki and their Chief Technology Officer and Chief Product Officer, Mandeep Dillon. Hey, you guys, nice to have you here.
Great to be here.
All right, so this is great. So I want to dive into like every little bitty bit of this because I feel like this is teen mental health is like, I think having a moment, and rightfully so. I feel like kids today have been going through the ringer, not only with the pandemic, but all of the other things of just growing up, and especially growing up in a very tech-enabled, always-on world. So I think let's start there. And before we get into the business model, Nicki, give us a little bit of an idea of what made you want to start this business that's so focused on mental health and specifically for that teen population. This is the only one, to my understanding, that's focused exclusively on teens, not just adding a teen solution to something else that's already built. Why?
Because we wanted to transform care for behavioral health care delivery for these teens. So the most diverse population, they're the most diverse and tech savvy generation we'll ever know. And so we looked at this as reimagining the problem to look at them in terms of natively digital. How can we be care focused and be natively digital? And that's what we're setting out to do.
I love that. Okay, natively focused, like a digital, and then also adding the care on top of this. So what does that look like? Like Mandeep, I understand that you guys are in early days, it should say, with the development of the product, but talk me through what you're designing here. And we can talk to you a little bit about what's already built, but talk to me about what you're designing here. And I read the Fast Company profile that came out on you, where they call you like TikTok for teen mental health. And I'm like, whoa, is that really what we want to do here? So tell me what's the reality of that?
It's a great question, because the reality for teenagers is that they're attached to their devices. We have a generation that has the most authentic communication platform. I grew up in a small town. If my parents didn't know something, my teacher didn't know it, or it wasn't available in the library, I wasn't going to know it. This generation will never not know something for the rest of their life. They're going to be connected to a device that fits in the palm of their hand and even smaller. And so what you need to really rethink is, how do you build authentic experiences around that? And you simply can't take what happened in a doctor's office and put it on a phone. And so when you start to think about what that means, is that the interaction models, the content, the experiences have to mimic the experiences that they would have on a phone today that they would otherwise find appealing. You don't want to say it's like the eat your vegetables moment, right? You want to make this just as appealing to them as everything else. And so right now, the most appealing app for teenagers is TikTok. And it's because it is authentic, it's vertical, it's video, it has a ton of audio based into it. And so for them, they see that as something that resonates with them. And so when we think about delivering solutions, we want to use what they see attractive today and adjust our content materials to fit in authentic experiences for them. The other thing about TikTok, and again, it's not to replicate it, but it's to understand, teenagers expect the content to be served to them. They didn't want to show up for a class. They want the class to be delivered. And so that's exactly what's happening here, is that you can use algorithms and machine learning to better understand what they want. And instead of building an algorithm that focuses on time spent or on advertising revenue, we could build algorithms that focus on happiness or that focus on their mental health. And so when you think about the juxtaposition of a TikTok with what we're doing, it's saying using the best of modern technology delivered in a mobile format directly to teens in an authentic way.
Okay, so is it like, this might be a very dumb question, but what does this actually look like? Does it look like actual like little videos, like TikTok videos? Are people dancing?
There will be those.
What is this like?
Yeah, so a very common teen pattern is content consumption, right? If you see a teen on their phone, that's what they're doing. They're death scrolling right now through a variety of different things on Instagram, on TikTok. And so we do have content that's related to that, because that is an authentic medium. They also have a variety of creators, and that's another thing that's really important. So the model is like, they will see videos in our experience. They will have what we're referring to as care activities, which break up their interaction. So they're not just consuming content or just creating content, but they're interacting with their devices in ways that help strengthen them. And then when they need to speak to humans for coaching or for other types of care, we provide that as well. So we use the phone as a way to deliver content, interactive experiences, and human support.
Okay. And now I understand that, Nicki, you guys had a teen advisory board help you kind of develop the design around this. So talk to me a little bit about that. What's the key takeaway from the teen advisory board?
That they're not little adults, Jess. They have their opinions, and, honestly, every key decision is going through them. Right now, we've got 30 different teens that sit on the teen advisory board, and it's across all socio-demographic profiling. And they just have been so honest with us. I would call it radically candid in terms of what they're liking that they're seeing on our platform and what they don't like. So we actually coined the phrase "with teens in mind" because it's not for them. We are literally building this company with them.
That's very cool. I like that. I like that ethos. And I think it can only help because this is a market. I mean, like, it's fickle. They're fickle. Like, they definitely have their own opinions, and it's definitely hard to get their attention. So, I mean, like, I'm curious about, I have a lot of questions about how this actually works. So it's like, well, how do you keep them engaged? And I'm curious too on the blend of the technology that's involved behind the scenes and the human piece of this. So it's like, that's a conversation I have in like the adult digital mental health world, is like, how much of this care delivery is being put onto like a bot or the algorithm, and how much of this then involves a person, and what does that blend look like, and how does it know when to do what?
Sure. So I think, for any, you bring up the point about teens being fickle, and I think the most important thing for them is they can see through things that we don't tend to see through, right? And so authenticity and trustworthiness are the most important things. And so when you think about how they engage with, the content that they're following on Instagram is authentic to them. It may not be authentic to us, and it may not be authentic to their friends, right? But they pick the things that resonate with them. And a lot of these platforms provide them that amount of variety. And so when we think about what those experiences need to be, it has to be authentic and trustworthy. And so with that in mind, we have to build experiences that they actually see as relevant to them. As Nicki mentioned, that's why we have the Teen Advisory Board, and it's with teens in mind. And so it really isn't about automating experiences, because that's not tremendously authentic, but it is about self-help, right? So what you're finding is it's a very resourceful generation. Like, you can ask them a question, and on their devices, they'll find an answer to practically anything. This is the most connected generation in history. And so they're really focused on what's authentic and trustworthy to them, but they're incredibly resourceful. So they can find out information about anything, but it's actually quite difficult to find information about their own mental health. So when we start to think about how we deliver that, we want to be very careful to deliver it in an authentic way. And so it's really not about like, how do you bot your way into giving them access to information? It's really much more about how do you build self-help? Because they are so resourceful. If you give them enough access to different information, particularly things that they find appealing, we believe that they'll find solutions they have. So everything that comes into our app is curated, and then any interaction experiences are moderated, not because we're trying to spy on them, but actually because we want to make sure that there's no junk science in the app. That when we do deliver content to them, it is delivered with, as Nicki and the rest of our team will be able to attest to, the highest quality of medical standard. But beyond that, it's about what is an authentic pattern, right? So I want to go look up this thing on my own, or I'm going to go adjust my mood. And we have certain types of features that are about them engaging with the app. That's how we use technology, and not really about using like automated responses and short form solutions. Because even though we seem to think that teenagers will be okay with that, it's really not the best way to give them that respect. And then there are lots of humans as well. And so we want to make sure that when they need to speak to someone and they need help in the moment, coaches are available to provide them access to the answers that they need, and not a standard response to an FAQ.
Nicki, do you want to add to that?
Yeah, I think the backed by science is a really important piece. Behavioral health has been a laggard with measurement-based care if you compare us to other medical fields. And so we've made it a point that everything is measurement-based and evidence-based. So every time you're looking at the content, nothing is siloed from it being backed by science, so that it can be that trustworthy and authentic experience that Mandeep is speaking to.
On the trustworthy, authentic experience side of things, particularly on the trust side, I want to ask this in two ways. Number one, for any concerned parent who's like, yeah, what about my kid's data, all of that stuff? Talk to me real quick about the privacy piece of this in that regard. And then I also want to know, how do you respect the teen's privacy from their parent, who maybe is concerned enough where they've helped their child find care, right? I mean, and like, even though you're a teen and you're well, you're not a little adult, right? You're a teen. So how do you make sure that they're in a place where the parents feel comfortable about what's going on, but the teen doesn't feel like, mom, get off of me. Like, and it's hindering their experience and their ability to engage and feel like they can, really kind of let go and let it out if they need to on this app. Like, what's the blend there? Like, talk to me about the thinking on that.
I'll start off. At the end of the day, we're not sharing information with anyone. We're not ad backed, right? So the data privacy issue that a lot of young people are very, very concerned about their privacy. I would say way more than adults are, not because of the privacy question you're asking, which is how do I keep my parents out of my business, but they're actually much more attuned to what data actually is worth. And so we do utilize their data for their benefit inside the app, but we don't ever share it outside the app. Okay. And so from our perspective, privacy is really about what you share stays here, but what you share is intended to help you and help other people to think through what those patterns may look like. The family privacy question is another one. So we don't actually have an experience today, and we're trying to figure out exactly how to think about it for the future that connects a parent into the child's experience. What we want to try to do is provide the kid with enough confidence where they can learn how to share with their parent. Okay. Because that's the most authentic experience we can provide. So our app is not a gateway for parental intervention, right? Our app is actually for the teen to have authentic experiences to help strengthen themselves. And part of what we will support them with is the idea that you have people around you. You have people you can trust. How do you find ways to open up those channels of communication? We will provide information resources to parents and families because we believe that's important too, but it's not related specifically to the data of the young person using the app.
Okay. Nicki, anything you want to add there, especially on the parent side of things? I'm very curious about that.
Yeah, because I think we want to preserve their autonomy, right? And we want to be able to help them. I think one of the difficulties our industry has had is engaging. There's really high non-adherence rates, non-compliance rates with teens that are needing mental health. So we want to make sure we get them to engage with us. At the same time, it is incumbent upon us to be able to make sure we give the parents tools, resources, etc. So it won't necessarily look like they're in the platform. So we're keeping that teen for that reason, so that they feel like they have a safe space to be, working on relational competence, all of those types of things. But on the side, we're going to allow ourselves to work through a parent strategy that will lay out that we're there for the parents with the resources, support, all of the tools necessary where they will benefit, so that both are taken care of, but not at the expense of the other.
Okay. Because this is an interesting area, I think, because that relationship between a teen and their parent, like that, maybe that's the problem, in some ways, right? And so you got to be careful there. So I like the fact that we're going to be arming parents with some tools too, to deal with their teen, or to help their teen with those issues that they might be having, even in that own dynamic that they share. All right, very cool. How does the teen get into this? So, we'll talk business model in a second, like the relationship with the payer, how it's being offered, but talk to me about the intake part of this for that teen patient, because I'm curious about that. This is an area for me. It's personally very curious about diagnosis on the mental health side of things. And I've read survey results. I believe it was Teladoc that did a virtual mental health delivery survey, 2,000 people. And these are adults, granted, but even adults said it was 65% of them didn't know what their diagnosis was when they went into treatment. They had no clue. So, as far as a teen, what's that first interaction like? And what are you guys doing to help kind of suss out what might be going on from a diagnostic standpoint? Or are they already coming to you with a diagnosis from a pediatrician or a doctor, and you guys are just providing the mental health, cognitive behavioral therapy type program for them after that point? Explain that to me. Nicki, let's start with you.
Yeah, so first of all, we're going after all teens. It's important to know that, because if you think about, most people think behavioral health context, but I'm also thinking about diabetic teens or other teens with medical conditions that would benefit from holistic care and have some sort of an augmentation type of support. So sometimes they'll be emotionally curious, or what about children that actually are more social determinants of health? And they're not necessarily teens that are psychiatrically challenged. So we're trying to appeal to all teens because all teens need support. All teens get stressed. So it's one of the things that's important for you to know is that we're going after it in a strength-based way. So I'm not seeing mental health as an absence of illness or symptomatology, but more about emotional growth and a striving for health model so that we can help all teens become their best versions of themselves. So as they come in, if it comes through, as you said, from a pediatrician, they may or may not have a diagnosis, or from a therapist. But us, in this, we will have certain assessment measures, again, very measurement-based, evidence-based, but we're not going to, go right off the bat with 25 questions that then scare the teen away. We might, splinter off the assessments to allow them to engage, to find some sort of a digital home for them, and then continue to, because we'll see this as an evolving working so that we can help them get to know themselves, we can get to know them, and we're in it for the long game.
Mandeep, what would you add to that? And specifically, I'm curious on the data side, because as you guys are learning, right? I mean, you're talking about algorithms, right? Serving up content to them. So you're going to have a lot of information, and it's going to refine over time to get smarter and smarter. Talk to me about that. And that's honestly, to me, one of the things that's very exciting about the digitization of mental health and even like well-being care is that we're learning a lot about the way we think, what we respond to, and you can get very granular because we have a digital trail now of artifacts of what's working, what's not working, what people are interacting with, what's not. And I love the potential this has in terms of helping advance this kind of care and our understanding of it. So tell me about the data side of this. And it's and I know, like we said, you guys are building, but what does this look like when it's full bore? Give me a sense of what you're building towards.
No, it's an excellent question. So, I have 3 kids, 3 teenagers, 14, 17, and 19, and they all of their friends need help at some point or the other, right? And I think the problem is we've equated that with need to see a therapist or have a diagnosed mental health problem. And in reality, that's not what we're talking about. We're talking about a much broader spectrum of needs, and gets back to the data question. It's I can measure all kinds of things based on what your mood is. I can measure based on how frequently you're coming in. I can measure based on the types of content that you're liking, right? Because that allows us to create baselines individually and mark them against other types of things. One of the reasons that we want to build an app like this for all people is that I don't want you to think about coming to this app when you're not feeling well. We often associate mental health with baseline to below baseline behavior. In reality, I should ask you, it's your friend's birthday. How do you feel? And it should be super excited, right? Because understanding the range of emotions and understanding when you're feeling good is one of the best ways to help you when you're not feeling good. So we take a lot of that data then and help feed it back to you in a way that allows you yourself, not some third party and not somebody who's trying to understand you, but you, to build some of those strength-based systems, right? So data really becomes at the core of everything that we do, because we want to see how do we allow you to be the best version of yourself. The whole idea of BeMe is to be the best self of your potential, right? And data can help us provide better access to some of those resources for you, to help you become the better version of yourself, by reminding you when things are going well, by giving you opportunities to kind of think about your mental strength. And another key piece of this, which is very difficult for teenagers to find, is that how do I help my friends? Oftentimes someone will come and say, I've got a friend who's got a problem, right? So actually BeMe gives you the strength to go find those same opportunities and connections. And we can even utilize that in helping you. If you've come in to help somebody else, we can feed back some of that same information to you at the right time. And so we will have a better range of information about teenage behavioral concerns and some of their key questions that'll allow us to refine both our content and how we deliver it.
I love this. And I think this is a good moment for this, because it's I feel like we've been hearing so much about, about content that is out there that is medical or well-being themed in nature, and it not being coming from credible sources. I mean, YouTube has a whole policy to counteract a lot of that. They have a whole division that does that. And then I think even too, at the same time, you have all this stuff swirling around social media and how it has not been the best for mental health. And so I love the fact that you guys are like turning both of those things on their head and like using the duality of that to do good. And I think that that's really interesting because you're meeting this market of teens right where they're at. Nicki, were you going to say something? I'm sorry, I think I cut you off.
Yeah. Absolutely. So the other part about why this is exciting from an algorithmic perspective is that you think about our industry, we also have not been great at precision mental health care. And so we looking at this, becoming more intelligent and compassionate to teens so that we can actually, at the end of the day, start to craft pathways and understand their interests and needs for the betterment of the field so that it informs and guides all of us and the sustainable tomorrow for mental health for teens.
I love that. And that's like totally like the thing, honestly, in the space I'm the most excited about. All right, let's talk business model real quick before we get out of here. I want to go back to the fundraise. So 7 million in the seed round and the partnerships, right? So there's a connection there between that. And the partnerships are with some payers. So Nicki, start us out there. Talk to me about that. And then also if you can tell us like what the relationship is with the payers, like, is this a per member per month kind of thing? Like, how is this rolling out to their populations?
Sure. So the partnerships, we've secured partnerships. We did a whole validation process, worked with 9 of the top 10 payers, and that enthusiasm and excitement of BeMe landed partnerships that will begin January 2022. I can't tell you who, but I can tell you that the way it will be designed as a payer partnership is that one will be funneled through the pediatricians and the therapists. And then the other, there's all sorts of acquisitions from schools and care coordinators, et cetera. So that what we're going to do is look at a large and a different type of population from commercial to Medicaid populations. So that again, we reach all youth and that we one of our important pieces I want to make sure I say to you is we want to make teen mental health care personal and equitable. In order to do that, we need to go after partnerships that allow us to get in touch and connected with all of these teens. Right now, the pricing strategy is a PMPM model, but what we're looking at, so you know, is our strategy will go beyond payers to all different types of partnerships, including a direct-to-consumer strategy. So we're doing that purposely because, again, we want to, at the end of the day, make sure this is in the palm of the hands of all teens. And in order to do that, there's an array of partnerships that we're interested in so that we can really make that exponential, difference that we're trying to make in this field.
Awesome. It sounds like you guys are going to grow fast. So 22, we're starting out with just the 2 payers and then we're evolving from there. Is that right?
That's correct.
Awesome. Exciting. All right. Well, thank you guys so much for stopping by. I mean, when I saw the news of this come out of your fundraise and your partnerships and just read a little bit about the business, I'm like, this is great. Like, I love this space to begin with. I feel like there is so much room for helping improve accessibility, cost, just engagement. And so it's like, I really am just super supportive of this space. And I especially love that you guys are focused on the teen market, because like I said, I think like right now it's like, they've had a heck of a time, these poor little sweethearts. So it's like, whatever we can do to help them out. Right. That's great.
We're very excited about it too. I think as you mentioned, there's a lot of opportunity and upside. Many of the adult problems relate to teenage years, and we believe by addressing teens directly at this point in time with devices in their hands and giving them the power to do things on their own, that has so much of a multiplier effect into the future. So we're very excited about what we're going to learn by putting this product on the market.
Awesome. Well, thank you guys so much again for dropping by, giving us this update on what you guys are doing, letting us pick apart all of the details behind the tech and the business model. I love to hear it. You have to come back as soon as we land another big partnership deal, or we raise some more money, or we go public, or whatever it happens to be in the future. Just let me know. I'm Jessica DeMassa. Joining me right now again, I have Nicki Tessler. She is the CEO of BeMe Health and co-founder. And along with her is one of the other co-founders, our 4 total, right? One of the other co-founders, we have Mandeep Dylan. He is the Chief Technology Officer and the Chief Product Officer. Thanks again, you guys, so much for stopping by. Congratulations on the fundraise. We got our eyes on you. Can't wait to see what you guys do next. I'm Jessica DeMassa. Stay tuned for more interviews of the who's who of health tech as they are changing the way that we do healthcare. You can check those out over there at my YouTube channel. It is youtube.com/WTF Health. Thanks again for joining me. Bye.
Thank you.